My name is Shane Brown, and I decided to do my oral presentation on breast cancer. What is breast cancer? Breast cancer is an uncontrolled growth of breast cells. This can happen through a genetic mutation. During mitosis, cells divide, and for example, unhealthy cells can divide as well. And this is a buildup of unhealthy cells in the chest region. And this is usually characterized by lumps, like I said, in the chest region. So if you feel anything in your chest area that is ball formed typically and then hard, you should definitely get it checked out by a physician. Breast cancer is diagnosed in stages 1 to 5. Stage 1 is non-invasive and stage 5 is invasive. You want to be in that stage 1 area due to the high survival rates. This is a picture showing you these survival rates. This is taken in 2012, so this is pretty recent data. And you can see that in the higher stages, the survival rates are about 100%, which is outstanding. Medical teams and medical treatment has come so far. And that you can see down towards the bottom, when you get into that stage 5 area, it drops off to 22%. So it is really important for early detection. If you talk to any survivors, they're going to say early detection, early detection, early detection. So get your mammograms done, which is what physicians will perform on patients in order to feel for these certain hard spots and lumps. Symptoms and risks. Risk factors could be poor diet, unhealthy weight, smoking, excessive alcohol intake, and not exercising regularly. There is no cure, so there is no definitive way to just not get breast cancer. It doesn't discriminate. It can affect anybody. Some symptoms are swelling of all or part of the breast, skin irritation or dimpling, breast pain, nipple pain or nipple turning inward, redness, scaliness, or thickening of the nipple or breast skin, a nipple discharge other than breast milk, a lump in the underarm area. This picture is awesome. It just shows how effective mammograms are, which is, like I said, the screening done by physicians in order to detect lumps. And you can also do these self-mammograms as well. Do them in the shower, typically with hot water, in order to loosen up that skin so you can get a good feel. Men and women should definitely perform these. This is just, mammograms are just really, really important for early detection. I can't stress it enough how important they are. I talked to my mom, which I'll talk about later, and she just says mammogram, 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 no matter what. So this is just showing you how important they really are. Treatment, radiation treatment is typical. Surgery, chemotherapy, drugs, and holistic medicine. Surgery can include a lumpectomy, which is going to conserve the breast tissue. So you're going to have your original breast, and they're going to go in there and microscopically take out those mutated cells. Or you can do a mastectomy, which is going to completely take off the breast, and you're going to reconstruct them through taking skin through other parts of your body and using that skin to recreate breast using silicone or some other type of artificial method. These are typically followed by radiation therapy and or chemotherapy, and for a mastectomy, reconstruction surgery is going to come into play. So you're going to have two surgeries. You're going to have the reconstruction surgery and then the removal surgery of the mastectomy, that's going to be your mastectomy. And so you have to expect more of a longer term of treatment for that. These are just a picture of some drugs that are going to be used for cancer. They range from all sorts of different kind of drugs. And then on the bottom right, we have a picture of two women just performing holistic medicine, in this case yoga for breast cancer, and it's been proven to reduce stress and anxiety in individuals who have breast cancer. On the top picture, we have a radiation therapy, and on the bottom picture, we have chemotherapy. Now, the issue with these is that it's not going to be just one treatment. There's going to be 3 or 4 treatments, or maybe even more, and they're going to take a couple months. These treatments are hard and difficult because they don't just attack your healthy cells. They don't just attack the bad cells. They're going to attack the healthy cells as well, which is why you'll see in patients they're going to lose their hair, and they're going to have other functional issues. Radiation is the same kind of way. You're using radioactive therapy, which is going to mutate your genes and such, which has its positives and its negatives. So that's the issue with these two treatments, but they do and they are effective. Breast cancer and exercise. This is important. Leading a healthy lifestyle, it starts with exercise, and diet and such things like that. And with breast cancer, you have to do it as well. Aerobic activity, for example, is what we're going to talk about first, which is going to be your walking, your biking, your swimming. We're going to talk about how much you should do that. It's going to be 5 times or greater a week, and at least 30 minutes sessions. And you want to perform that moderate activity level because you're going to have a hard time doing the vigorous activity and really pushing yourself, because you're going to be pushed through all these surgeries and the medications that you're on. They are very detrimental to your body, and you'll see that you're going to have an extra increase in heart rate due to that stimulation of your sympathetic nervous system from these drugs that you're on, and also the radiation treatment that could affect your skin. So it's going to make your skin irritated. So really pay that extra $1 for some comfortable clothing, and maybe get the better brand out there. Another important key factor is rest. Your body's going to be so fatigued from all these surgeries, appointments, scheduling, you name it. It's all on there. You're feeling nauseous, you're feeling anxious, you're feeling stressed. Please rest as much as possible. The benefits are going to be good. You're going to get a jump in energy. It's going to be good for your heart, keep your heart healthy while you're going through these diseases, because the heart's is going to keep your body going. And it's going to help you reduce that anxiety and stress you have feeling from the disease and overall mental health. So it's going to help you with all that kind of stuff. Resistance training. Frequency is going to be 2 to 3 times a week, and plan for rest days in between. Moderate to vigorous activity is recommended, so 40 to 60% of your 1RM. You can even go higher as you get more and more proficient in weightlifting. Intensity, you're going to do 10 to 15 reps. You're going to do this moderate activity, so it's going to be a little bit of a higher volume in order to keep that muscle mass growing. You're going to do 1 to 3 sets using all your muscle groups. Start with machines as you're learning, and then progress to free weights. You're going to help conserve your energy on the machines a little bit there, because they're going to help aid you through the movement. But as you begin to feel better and become more advanced, you're more than welcome to go to the free weights in order to get a more dynamic workout. The benefits are going to be movement. Your body's going to be able to move better. Your muscles are going to grow, and it's going to help you maintain your weight, because you will be losing weight because of a lack of appetite from the drugs and nausea. So it's important to keep that resistance training going, keep your body healthy, and keep it stable. Flexibility is really important as well. For individuals with breast cancer, you should start stretching after every exercise session. We recommend this 5 times a week, part of your exercise prescription. Hold these stretches for 10 to 30 seconds, 3 times each. Yoga and Pilates are great ways to improve flexibility, and they have proved to strengthen the body, help delay fatigue, and reduce stress and anxiety feelings from the medications that you're feeling. So it's really important to keep your body flexible. It's going to help you. It's going to help promote blood flow at different areas of your bodies and your muscles and keep you more active. This is my personal story with breast cancer, which was a crazy experience for me. What a challenge it really was to go through this, but it was awesome to go through with my family, and we came out on the other side, and it was amazing. We were blessed from it. We wouldn't change it for the world. We love and hate every second of it. But my mother is actually a 2-time survivor. She was first diagnosed in 2011, and it came back in 2013. In 2013, she did have stage 2, so she did elect to have the bilateral mastectomy, meaning that both of her breasts were removed and then reconstructed. These were both followed by chemo and radiation therapy, and this was just an awful thing to see someone go through. It's kind of like seeing someone with the flu for 24 hours, 7 days a week, after these treatments. And there's 3 or 4 treatments, so it's almost like a month of complete and just utter illness. It's really horrible to see someone they're so fatigued, they're throwing up, they don't feel like doing anything, they have a hard time eating. It's really hard to see someone go through that. But she did counteract that, especially after the fact, with diet and holistic treatment. She really stays away from certain kinds of food, such as soy, which has been linked to certain kinds of cancers. And she is into exercising. She definitely harps more on the diet aspect. She's into quinoa, certified organic stuff. She really tries to eat healthy. For example, just even live healthier. She won't even want to be around smoke. If someone comes over at our house and has a cigarette or something like that, an uncle or a relative or something, she'll just go in the other room because she doesn't want any of those carcinogens causing mutations or anything like that in her body. It's just something that you live through, and you learn as you go with a disease like this. Here's just a couple of pictures. In the bottom left is just her and my sister back in high school, and you can see the effects from the radiation, the chemotherapy, as she has hair loss. That's a typical effect. It's just her in her early stages. And then in this top picture, it's her and her friends. They did a Susan G. Komen walk. She had a great time. They raised a bunch of money, and they did a 3-day walk. You slept in tents and stuff, and you were just all breast cancer all day. That's all it was. And it's a really big, tight-knit community. And then moving to present day, we have a picture of my family and I. They came up for Parents Weekend on the right here. We had a great time. It was just awesome to have them around. So you can see that this disease has changed her, but she's grown back and became her normal self again, and stronger because of it. And then in the middle, she works for this organization called HCF, and they support individuals who have had or have breast cancer, and she is accepting her award for her part in that. She really loves that organization. She helps so many women and men through their experiences, through telling her. She blesses others. She helps pray with them, all that kind of stuff. Anything she can do for them, she's there for it. Never stops for her. She's doing it 24 hours a day. So she's really just loved doing that. And overall, it's been awesome to see her, been blessed by that. And she's helped to really shape the rest of her family through this as well, and teach them things about what really matters and what's important in life. So this disease has been a big part of our lives for, it never goes away. So it will always be a part of our lives. So, and it's been awesome to learn from this. More information and references. The National Breast Cancer Foundation is an organization that's out there as well. But breastcancer.org, if you have any questions, they have their answer. It has everything there, from symptoms, diagnosis, treatment, everything. Down at the bottom are a couple of my references. I knew a lot of this stuff on my own just from living through it, but these references down here really help to expand my knowledge and help aid me through along this project. And it was easy to do this project for me because I know most of this stuff. So, but it was awesome just learning more and talking to my mom about it too, just getting an updated version and stuff. So that's it. Thank you.